hip bone. In example of pelvis, we can find all types of articulation. For example, synarthrosis consists of syndesmosis, synchondrosis, synostosis, and symphysis. Syndesmosis, that is ligaments and membranes. Ligament, it is membrane, first of all, membrane closed obturator foramen, that is membrana obturatoria, obturator membrane. Here and here, that is membrane, and ligaments. Ligaments, a lot of ligaments in the region of this joint, sacroiliac joint, and in the region of pubic symphysis. That is why when I will describe these two joints, I tell you about ligaments in a minute. Now, synchondrosis, temporal synchondrosis in the region of hip bone. It consists of iliac bone, pubic bone, and sciatic bone, yes? And these three bones fuse together with the help of cartilage. That is temporal synchondrosis, which replaces into synostosis, one bone, hip bone. The same about sacral bone, because sacral bone, it is part of pelvis. And coccygeal bone, the same, coccygeal vertebrae fuse together with the help of temporal synchondrosis and replace into synostosis. All of these three bones, hip bone, sacral, and coccygeal bone, they are temporal synchondrosis and then synostosis. And symphysis, pubic symphysis, two symphysial surfaces of pubic bones, and between them insert cartilage. It is discus interpubicus, and inside of this cartilage we have cavitas. That is why it is pubic symphysis. It is not synchondrosis but symphysis, because inside of this cartilage we have cavitas. That is discus interpubicus. In time of delivery of fetus, this symphysis may be dilate in 1-2 centimeters. That is, pubic bones may be dilate in pubic symphysis. Two ligaments necessary to know: ligamentum pubicum superior, above of pubic symphysis, and ligamentum arcuatum pubis, below of pubic symphysis. These two ligaments are syndesmosis. And diarthrosis, that is sacroiliac joint. Do you remember facies auricularis we have on sacral bone, and the same facies auricularis on iliac bone? These two surfaces join together and makes articulatio sacroiliaca, sacroiliac joint. It is plane, combined, two joints work together. In theory it is multi-axial, but really it is amphiarthrosis or tight joint with small volume of movement. That is why we will not discuss which movements are possible here, because all of these movements are in very, very small volume. For example, the same in time of delivery of fetus, these two iliac bones, they dilate in pubic symphysis, and the same in sacroiliac joint, the same. Clear it is. Ligaments. One ligament is between spinal process of fifth lumbar vertebra and iliac crest, ligamentum iliolumbale, between lumbar vertebra, transverse process of fifth lumbar and crista iliaca.